Hello, I'm Dr. Anglina D'Costa. Over the years, I've noticed that many men search for complex solutions, while ignoring simple methods that work with the body's natural systems. One such method that has recently gained attention is controlled cold exposure, using something as basic as an ice cube. This technique is not new. Cold has long been used in medicine to influence circulation, calm overactive nerves, and help the body regain balance. What's changed is that more men are now looking for safe, drug-free approaches to support their overall well-being. In this video, I want to explain why this method works, when it can be useful, and how it should be approached responsibly. This is not a shortcut or a cure, but a practical technique that helps you understand how your body responds to temperature, awareness, and control when done correctly and safely. Before we dive in, let me quickly ask you to support this channel. Give this video a like, drop a comment below, telling me where you are watching from, and hit that subscribe button so you never miss my latest men's health updates. Let's get started. Firstly, let's understand the science behind cold exposure and nerve response. To understand why controlled cold exposure can be helpful, we need to look at how the nervous system and blood vessels respond to temperature. When the body experiences brief, mild cold, sensory receptors in the skin send signals to the nervous system. These signals cause blood vessels to temporarily tighten and then relax once warmth returns. This natural response helps improve awareness of circulation and supports healthier vascular control over time. Cold exposure also influences nerve sensitivity. In many men, everyday stress keeps the nervous system in a constant, alert state. Short, controlled cold stimulation can interrupt this cycle by calming overly reactive nerve signals and encouraging a more balanced response. This is why cold therapy has long been used in sports medicine and rehabilitation. It's important to understand that duration and intensity matter. Excessive cold or improper use can cause discomfort or harm. When applied briefly and safely, however, cold exposure acts as a reset, helping the body recognize changes in sensation and regain control naturally. This technique is not a treatment or cure, but a way to support the body's own regulatory systems when used responsibly. While this simple cold exposure technique can be useful for some men, it's important to understand that it is not suitable for everyone. This approach may benefit men who are generally healthy and looking for a natural way to improve body awareness, nerve balance, and circulation response. It can be especially helpful for those who experience heightened sensitivity, stress-related tension, or age-related changes and want a drug-free method to support overall wellness. Men who exercise regularly, manage stress, and follow healthy lifestyle habits often respond better because their nervous system adapts more efficiently to brief temperature changes. However, this technique should not be used by individuals with certain medical conditions. Men with diabetes, nerve damage, circulation disorders, cold sensitivity conditions, or open skin issues should avoid cold exposure without medical guidance. Those recovering from surgery or managing chronic health problems should always consult a qualified healthcare professional first. Cold exposure is a supportive technique, not a medical treatment. Used responsibly, it can complement a healthy lifestyle, but safety must always come first. Listening to your body and knowing your limits is essential. Now in this section I will explain how to use the ice cube safely and correctly. When it comes to any cold exposure method, how you use it matters more than the technique itself. Safety and moderation are key. First, always use a clean ice cube wrapped in a thin cloth or tissue. Ice should never be applied directly to the skin for extended periods. The goal is brief stimulation, not discomfort. Apply the cold for a few seconds only, then remove it and allow the skin to return to its normal temperature. This short exposure is enough to activate sensory receptors without stressing the nerves. Second, choose a comfortable, seated position and focus on slow, steady breathing. This helps the nervous system stay relaxed and prevents unnecessary tension. Never rush the process or increase the time thinking it will improve results. It will not. This technique should be used occasionally, not repeatedly throughout the day. Once is enough. If you notice numbness, pain, or lingering discomfort, stop immediately. This method is meant to support body awareness, not replace medical care. If you have any underlying health concerns, always consult a healthcare professional before trying cold exposure techniques. Now I will discuss mistakes most men make that reduce effectiveness. Many men say this ice technique doesn't work is because it's often done incorrectly. The method itself is simple, but small mistakes can completely reduce its effectiveness or cause unnecessary discomfort. The first common mistake is using the ice for too long. Cold exposure is about brief stimulation, not endurance. Holding ice on the skin for extended periods can irritate nerves instead of calming them. More time does not mean better results. Another mistake is applying ice directly to the skin without any barrier. This increases the risk of skin irritation and numbing, which defeats the purpose of controlled sensory activation. Always use a thin cloth or tissue. Many men also try this technique when they are already stressed or rushed. A tense nervous system does not respond well to cold stimulation. Slow breathing and a calm environment are essential for the body to respond positively. Using this method too frequently is another issue. This is not a daily ritual or something to repeat multiple times a day. Occasional use is sufficient. Overuse can desensitize the skin and reduce awareness. Finally, some men expect this technique to be a replacement for healthy habits or medical care. Cold exposure can support body awareness, but it cannot compensate for poor sleep, high stress, lack of physical activity, or unmanaged health conditions. When used correctly, this technique can be helpful, but only when approached with patience, moderation, and realistic expectations. Understanding these mistakes is the key to using it safely and effectively. So there you have it, viewers. Dr. Anglina D'Costa signing off this video. Finally, I want to leave you with a clear and honest message. No single technique, no matter how simple or effective, works in isolation. Long-term results always come from understanding your body and supporting it consistently with the right habits. This cold exposure technique can help increase awareness of your nervous system and circulation response, but it should be seen as a supportive tool, not a solution by itself. What matters most is how you care for your body on a daily basis. Start with stress management. Chronic stress keeps the nervous system in a constant alert state, which reduces the body's ability to regulate sensation and blood flow efficiently. Simple practices, like deep breathing, regular physical activity, and adequate sleep can make a noticeable difference over time. Next, pay attention to circulation health. Staying active, maintaining a healthy weight, and avoiding long periods of inactivity help support natural blood flow. Even gentle movement each day encourages healthier vascular function and nerve communication. Nutrition also plays a key role. A balanced diet that supports heart and nerve health helps the body respond better to any technique you use. Hydration is equally important, as it supports circulation and tissue health throughout the body. It's also essential to listen to your body. If something causes discomfort, numbness, or concern, stop immediately. Pushing through discomfort is never the answer. The body responds best when it feels safe, not forced. Most importantly, be realistic with expectations. Natural techniques work gradually by improving awareness and balance, not by creating instant or permanent changes. Consistency, patience, and healthy routines always outperform shortcuts. If you have ongoing symptoms, medical conditions, or concerns, don't rely on online advice alone. A qualified healthcare professional can help identify underlying issues and guide you safely. My goal is not to promise results, but to help you understand your body better and make informed choices. When you combine knowledge, safety, and healthy habits, that's where real, lasting improvement begins. Stay informed, stay patient, take care of your health. Thank you for joining me. If you found this video helpful, don't forget to like, share, and subscribe for more natural health tips, designed especially for seniors who want to stay healthy, strong, and independent. May you continue to walk with strength, energy, and joy. Until next time, take care of yourself, you deserve it. Thanks for watching.